Well, there's a lot of really active research happening now for ovarian cancer, and a lot of it's very exciting. I think it's easy for us to forget that, just over 5 years ago, we didn't have any declared symptoms of ovarian cancer, and that's why it was called the silent killer. And now we know, wait, there actually are some symptoms for ovarian cancer. In addition, there's a lot of work being done around early detection, and while we don't have anything yet, there's some big studies that are on the horizon that are going to come out in the next couple of years that'll at least give us clues into whether CA-125 is or is not useful in early detection, and whether it should be a population-based detection test or not. And there are some other things that are happening in both therapies and treatment with ovarian cancer. So I think probably over the next few years, you're going to see 2 to 4 new treatments potentially approved by the FDA, which is very exciting. And there's some fantastic clinical trials that are happening at the National Cancer Institute here in Washington, D.C. at the National Institutes of Health. And I would tell any woman that clinical trials are a wonderful way to really get in on some of the new breakthroughs that are happening. So, we've got some things in the bucket on early detection, and we'd like to have more, quite honestly. The science isn't fantastic yet, but again, that's why we need to invest in research. We need to invest a lot. And then we have some really great things that are happening on the horizon around treatment, which we hope will help to increase the survival rate and, of course, increase the overall survival, not just progression-free, but overall survival of women. So, sometimes we get very impatient, and we forget that, the gene was just mapped about, 10 years ago? So we have a lot yet to uncover. There's going to be a lot of keys unlocking a lot of doors. And I think you're going to start seeing a lot of things, not just in ovarian cancer, but in cancer in general, as we learn more and more about the human genome.
Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
about personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.